Hi, my name is Daniel Zainfeld. I'm a urologist with Urology San Antonio. I treat all urologic cancers, but deal especially with bladder cancer. Bladder cancer is a common diagnosis. It's most commonly diagnosed in men, but can occur in women as well. General early symptoms include blood in the urine that can be microscopic or gross blood that's seen. Sometimes irritative voiding symptoms can happen as well. When we see patients, initial evaluation generally includes some sort of imaging, so a CT scan or ultrasound, as well as a procedure called a cystoscopy, which is looking with a camera directly into the bladder to visualize any tumors that are there. We sometimes use a technology called blue light cystoscopy, which is a form of enhanced cystoscopy that allows even more sensitive visualization of tumors in the bladder. When tumors are seen, initial treatment is done through a procedure called a transurethral resection of bladder tumor. That's an outpatient procedure, again done with a camera placed through the urethra into the bladder. It allows us to look within the bladder to see the tumor and then resect or scrape those tumors out. Tumors that are removed from the bladder are then sent to a pathologist where they're examined to determine the histology, the pathologic grade, and the depth of invasion into the bladder wall. When we talk about treatments for bladder cancer, these are dictated significantly by the grade and the stage of disease. And it can span a wide spectrum, so it can be somewhat confusing for patients dealing with low-grade disease all the way to invasive and metastatic disease. Low-grade disease is often treated very conservatively, scraping within the bladder, sometimes medications within the bladder. More aggressive and invasive disease is treated very aggressively. So sometimes chemotherapy, sometimes surgery to remove the entire bladder. Regardless, bladder cancer can be a complicated disease to manage. It requires close surveillance. Here at Urology San Antonio, we have advanced technologies and significant experience in handling and managing every stage of bladder cancer. We have a robust clinical trials department with clinical trials open in almost every stage of cancer as well, allowing us to offer novel treatments to patients when they're eligible for that. Bladder cancer can be confusing. It's a difficult disease to navigate. At Urology San Antonio, we have advanced treatment options and advanced evaluation, and we would be happy to help you navigate this confusing space.